My name is Lecturer Kilaji, Bishop Kenya Michael Loltome speaking here in Nairobi National Government. Embakazi East Constituency, Embakazi, what they call Miango. Yes, I just want to talk today on Friday 17th, that is October 2025, about what is actually happening today in Kenya. Particularly, today is a day which is so sad day in Kenya. So I, Bishop Kenya Michael Loltome, who is also looking forward to be Kenya president come 2027 election. I just want to speak a bit of, the late Honorable Sir Dr. Raila Odinga matters, which of course they are of great concern to all Kenyans and also other nation human beings. I've been actually following Raila Odinga, medication and that kind of when he was actually hospitalized from last week, Saturday on 4th October 2025. That was on Saturday until some days ago, which is about Wednesday, 15 October 2025, what has transpired according to his medications. The way I've learned, I can say beyond reasonable doubt that Raila Odinga, female doctor, Sister Alphonse, cardiologist, and unqualified medical Kenyans animal person who is actually treating animals but is unqualified doctor called Dr. Okesh of Kenya, and also female doctor from India, Alphonse, cardiologist. They have mishandled Raila Odinga. Why am I saying so? Dr. Okesh of Kenya, Sala, who is actually a personal assistant to Dr. Raila Odinga, is an unqualified doctor. He has treated hippopotamus, brain injuries one time and let it go, and also a hyena. So that one does not qualify him to be, a human doctor. So I, Bishop Kenya Michael Loltome, speaking on behalf of God as a mouthpiece, directly through Biblical Media Network on planet Earth out to upward sky location and heaven realms, in Isaiah 61 verse 1 and John 14 verses 1 and 2, categorically, I can say that the Devamada Hospital in Kerala, southern India, where former Prime Minister Raila Odinga died, had mishandled his life to die deliberately for mysterious reasons. In James 4:17, Ajwaya Kutenda Mema attending the Dhambi. So Raila Odinga was mishandled because of what? We are told that day on Wednesday, before 9:52 minutes a.m. on Wednesday 15 October 2025, he was well, and he was actually doing his, kind of a routine kind of an exercise inside the hospital, which is called actually Koshi, private hospital in that case. So I can say we are beyond reasonable doubt, I being a theologian scientist expert in the Faculty of Religious Political Philosophy, because I'm looking forward to be a presidential contender on 13 September 2027 elections, with other leaders also, like my vice president, Honorable Gugubo, and also, my two ladies, first ladies, including even Dr. His Excellency Raila Odinga, youngest daughter, Honorable Mesa Winnie Imka Raila Odinga, Winnie Raila Odinga, and also, the Kenya president, youngest daughter, also Honorable Mesa, also likewise, Charlene Ruto, they are going to be my wife because I'm sure I will win the election, beyond reasonable doubt. I also have two prime ministers, that is also, Honorable Dr. Barack Hussein Obama, and also Dr. Kalonzo Musyoka in the next government. So according to me, Bishop Michael Loltome, the most profound question I've discovered that those doctors beyond reasonable doubt, that Indian nurse, doctor, cardiologist, and also Dr. Kesh, they have to face some kind of repercussion judgment because they have current, a kind of they have not become careful in Koshi hospital doctors kind of, matters. Repercussion in healthcare mishandling can include the severe legal and financial penalties for the individuals and facilities significant for harm of patients and negative impact on the reputation of the providers and of that institutions. So I can say they are supposed to face some kind of, court fines or jail term and that actually for their, mishandling Raila Odinga kind of life. So the repercussion can also be a legal and financial penalties in that kind of facility in India because that kind of reputation of their mishandling can lead to a severe reputational damage of that institution and also impacting public trust and confidence not to be, operational in a visibility kind of manage. Serious mismanagement can also threaten the financial feasibility, long-term operational success of healthcare facilities, and also that's why it is actually considered as, if people are delayed to be, diagnosis, all right, and postpone the treatment for delivery actions can create kind of a problem that can lead to death. So I can say today Kenyans are in emotional and psychological distress, all because of that patient which was mishandled, Raila Odinga, and he was mishandled in that case. The most profound question I, Bishop Michael Loltome, have also tried to follow online. I have asked actually, is this true that the Raila Odinga died? Well, is it yes? It is true, yes. He has passed away in India where he was undergoing treatment and he suffered cardiac arrest in his morning time in Sri Zariyam Aviadik Eye Hospital Research Center in Kerala, India. On 10th, on 15 October at 9:43, and the exact day he has died was actually on Wednesday that day. So Raila Odinga passed away on Wednesday, October 15, 2005 in India due to cardiac arrest while undergoing treatment according to the doctors which have mishandled him. So I also asked actually what did Raila Odinga pass away in? That was, I said, the death. And also Raila Odinga actually died approximately on Wednesday 15 October 2005 approximately 9:52 a.m. local time in India following cardiac arrest according to them. And he was brought up in Kenya now the following day after that. That was on Thursday. So I can say beyond a doubt actually it is actually the information available Raila Odinga family members are also there. We are told actually it was Rosemary was available there, and also that Okesh doctor from Kenya, Salah, was there with him. So there's no mention of others actually, according to what I've gathered the information. So I, Bishop Kenya Michael Loltome, I can say beyond reasonable doubt that there is no multiple mention of multiple doctors attending him, Raila Odinga specifically that day. But his daughter Rosemary and his personal doctor, then in that case Okeche Salah, was actually there at that time. But we are not told that they have been with him when he was walking and he was found actually lying down. So we don't know what has transpired from there. Another thing actually I want to say that there is no information suggesting Raila Odinga has walked before that day. Actually is according to the available information that he was actually also just walking as a normal person inside the hospital. They call it Avidividik Care Hospital in Kottakulam, Kerala, India, where he was undergoing treatment. Now the question is, how can an unwell person walk? So he was well, surely, beyond reasonable doubt. So, and we are told why. We are told he used to go in his own rehabilitation treatment plan, considering his condition and improve actually. So he used to do some kind of exercise. So walking short distances was not a kind of a vital kind of a problem which can cause him to die. So something must have triggered his death actually of mishandling. And also while walking inside the hospital, there's no in doing that kind of rehabilitation exercises. We don't know whether Raila Odinga slide or fall down in that case without anybody seeing, and then that kind of impact also has caused him to to go at that kind of a problem of cardiac kind of unrest in that kind of moment. So we are told that he was actually picked up by an unknown person when he was collapsing on the ground, and there is no information available who picked him, in that kind of facility when he collapsed and died. So according to me, I can say Raila Molo Odinga, beyond reasonable doubt, not only illnesses that has actually of course a cardiac arrest has killed him, but he was also mishandled in that case. Cardiac arrest can be caused by various factors that I have gathered that heart attack can do it in a kind of, they call it myocardial infarctions, and also number two, electrical disturbances in the heart, arrhythmias, and also number three, structural heart problem. They call it hypertrophic cardiomyopathy, and also number four, infection of endocarditis, and number five, trauma or injury to the heart or chest when he has now fallen down. Number six, certain medication or toxin excess can also cause problem. And number seven, electrolyte imbalances of potassium and magnesium can also be a problem. And also other underlying medical condition, heart failure, coronary artery disease can also be a problem. So these causes can disrupt the heart normal functioning, leading to cardiac arrest if the doctors are, treating you or are not very careful. So we are told Raila actually arrived on Saturday, will be buried on Sunday. In that case, after all that kind of a mess. So those are also what we have gathered. So beyond reasonable doubt, Raila Molo Odinga will be buried on Sunday, and the exact burial and site specified information provided is not specified because it is underway from Siaya. And also rural, home for what expected to be one of the most solemn state burial in Kenya history. Given the mention of Siaya, county government and rural route, it's flexible that he might be buried there potentially near family members, including his mother. However, without further information, we cannot say for certain how he is going to be, lying with whom in nearby grave. Raila Molo Odinga, then Banro State will be a military kind of honors. President His Excellency William Ruto announced the state burial, declaring 7-day national mourning period in honor of the Odinga's contribution to Kenya democracy and unity of purpose to all Kenyans. The government will oversee the burial arrangement with the Deputy President Honorable and Senator Honorable Oburu Odinga co-chairing the National Funeral Committee. So Odinga had been undergoing treatment in India for a few days before his death on Wednesday, 15 October 2025. After suffering a minor stroke in Kenya and was initially hospitalized in Mumbai, India, before he was transferred also to that eye hospital in Kerala for further treatment. I can say also myself, the way I have gotten some information why the Odinga illness took only 11 days to kill him. On Wednesday, 15 October 2005, we can actually say he arrived in India on October 4th after suffering a minor stroke in Kenya and was initially hospitalized in Mumbai before being transferred to the Seradariam Aviadivic Eye Hospital in Kerala for further treatment. He ultimately passed away on October 15, 2005 due to cardiac arrest, according to the doctor's kind of information. So how many times did Raila have been hospitalized, in his early 8 years before his death? We are told actually Raila Molo Odinga was hospitalized 3 times. He was hospitalized after suffering minor stroke in Kenya, which led to his treatment in India. Number 2, Rosemary also was treated there in Seradariam Aviadivic High Hospital in 2019, where Raila himself later sought treatment likewise. And number 3 was also mentioned to have passed by the National Hospital for a routine checkup in March 2022, just days before contracting COVID-19. So is Raila Odinga personal doctor or medical specialist doctor? We are told no. Is not actually a specialized doctor with verified medication credentials. In fact, it is actually, it was told by opening and closing inverted commas, by talent and passion rather than formal medical training. He is accredited with some remarkable field in animal health and performing surgeries on hippopotamus and hyena. Before that. So we cannot say that he can be, a good person who can be actually treating human beings in that case. So Raila had been in poor health for several years before his death, suffering from various elements, including prolonged condition of ulcerative colitis. Despite the deteriorating health, there were concerns about the transparency and adequacy of medical care and he had received before. So some question can be raised about why he wasn't assigned an expert medical team or treated in a more suitable facility earlier before his death in that case. So I can say I Bishop Kelly Loltome, why was Raila not assigned expert medical doctor despite his deteriorated health for many years? It is actually a kind of a negligence in that case because the occurrence among 8 other types will likely kill Raila Odinga in India Koshi Hospital. We are told there are so many other reports which is actually available. That is he has experienced in a ventricular fibrillations and baseless ventricular tachycardia, both of which are life-threatening and require immediate medical attention. One of them, the event leading to the death, suggests an acute coronary event. He was also walking and seemingly recovering from a mild stroke. So when somebody was not nearby, he actually fallen down and possibly also got some kind of a problem. And he suddenly also collapsed during that morning walk in that case without anybody nearby. And medical effort to revive him was unsuccessful then in that case. And also considering his sudden, kind of nature of his age, it's likely that the heart disease played a significant role of killing him also in that case. So the sickness reported of Raila Odinga before collapsing to death was told by doctor. So about that kind of information I've given. So actually we can say that a mild stroke also is known as transient ischemic attack TIA in a TIA or mini stroke occur when the blood supply to the brain is temporarily interrupted. And Raila Odinga case, the report indicated that he suffered minor stroke, but exact causes and specified. However, common causes of mild stroke include blood clots, blockage in blood vessels, high blood pressure, atherosclerosis, hardening of the arteries, heart conditions such as atrial fibrillations. These factors can lead to temporary disruption of blood flow to the brain, resulting in stroke-like symptoms, which can often be treated with medication if the doctors are nearby the people. So that mild stroke that strike Raila and cause death. In that case, we are told and also had probably also brain injury. So after falling, so that kind of problem can cause problem. Remember also, His Excellency Raila Odinga health issue stemming up in his imprisonment in Kenya included head injuries. He was beaten up with a broken table leg, leaving him blessed and collapsed. An neurological complication, the trauma led to hydrocephalus, a life-threatening buildup of fluid in the brain. Long-term effects in neurologists note that repeated head injuries can lead to long-term complications, including headache, fatigue, and neurological damage. So these health issues have had a lasting impact on his life before his death. And we are told also subdural hematoma is a type of bleeding in the brain, especially between the brain surface and the dura mater, a protective membrane. It is often caused by severe head trauma, which can lead to blood accumulation and increased pressure on the brain. So His Excellency Raila Odinga case is reportedly suffered a subdural hematoma due to severe beating during the imprisonment in 1980s. The injury required neurosurgery to relieve pressure and drain the accumulated blood. The condition can cause various symptoms, including headache, confusion, dizziness, weakness, and numbness, and loss of consciousness. So it can also prompt medical attention that is crucial, in treatment of subdural hematomas and preventing further brain damage, which actually helped him for some years. So beyond reasonable doubt, actually, we can say it's not only arrest, the one who have killed Raila Odinga, but also other underlying kind of a complication I mentioned, like also physical exertions. Odinga collapsed during a morning walk, which could have put strain in its cardiovascular system. Number two, environmental factors. That day, we are told warm and humid climate of Kerala in India, he was also receiving treatment, might have exacerbated any underlying health condition that have prompted him to die. Underlying health issues, Odinga had been battling bacterial infection and was also bed rest for some years, which could have weakened his overall health. And Ayurvedic treatment, although there is no direct evidence, potential interaction between conventional medications and alternative therapies cannot be ruled out of his death. And also, obviously, age-related health decline at 80, Odinga's body might have been more susceptible to certain health crises that can kill him. So these factors combined with the cardiac arrest likely contributed to the sudden passing away of Raila Amolo Odinga. So actually, that is actually what I can say this evening, and his burial now is scheduled for Sunday, October 19, 2025, at his ancestral home in Bondo, Siaya County. The funeral service will be conducted according to the tradition of the Anglican Church of Kenya, there in Bondo, in Siaya, and also a presiding bishop which is going to bury him. We are not told in Bondo. And also, we are told also that it will be also other burials like traditional of Luo, which of course will be also the rite may be fully not incorporated due to Anglican Church guidelines, but it will be there after that. But the burial will still take place in ancestral land, this cultural heritage of Luo. Okay, because how burial of Luo is done is actually, we are told, Luo traditional burial customs are deeply rooted in their cultural and spiritual beliefs. Here, some aspect, location, burial typically take place near the home or in a designated burial ground. Preparation, the body is washed, anointed with oil, and dressed in traditional attire of Luo tribe. Funeral rites, elders perform rituals such as chanting, singing, and drumming to guide the deceased spirit to the afterlife death. Grave preparation, the grave is dug by hand, often male and female family members. Okay, burial, the body is placed in the grave, usually facing the direction of the ancestral lands. Number 6, mourning, family members and community members of some mourning period which can last several days. Number 7, ancestral connection, the Luo believer tribe. The deceased becomes an ancestor and rituals are performed to ensure that spirit is at peace. This custom may vary depending on the specific Luo subclan or region. The Luo people place great importance on honoring the ancestors and ensuring dignified burial. And then we are told in traditional of Luo, the mourning period typically lasts for several days, often ranging from 4 to 7 days or even longer, depending on the specific custom and the circumstances. During this time, we are told actually family members and community members gather to pay their respect, share stories, perform rituals to honor the deceased. The mourning period usually includes various activities such as the funeral rites and ceremonies performed to guide the deceased to spirit afterlife. Visitation family members visit the bereaved family today to offer condolences and support. Cleansing rituals. Rituals are performed to cleanse the deceased family and home of the spiritual impurities. And funeral feast, food and drinks are shared among the mourners to celebrate the deceased life and provide comfort to the family. The exact duration and specific the mourning period may vary depending on the individual's social status, age, and circumstances of death, as well as preferences of the family and community. And so, Luo tribe, a traditional mourn the dead people in the honor and respect. And population expected is actually 1 million of Kenyans, and expected to go to Bondo to attend the Honorable Raila Odinga burial, with many more paying their respect through public viewing spaces and livestock broadcast TVs and radios, the media houses. And the government has set up public grieving spaces with a big screen to accommodate a large number of people who want to pay their respect there. And also other places like today in Nyayo. And the funeral arrangement includes state funeral service to be held on other days which have now passed, like Nyayo, and then Moi Stadium, and then other places like now is a Bondo farm in Bondo, Siaya County, according to the tradition of the Anglican Church. Given the large number of attendees, the government, the funeral committee have urged Kenyans to maintain peace and dignity during the mourning period of that kind of burial time. So, Dr. Raila Amolo Odinga, Dr. Azala is not a former medical doctor. You get that one right? So, he's not trained medical doctor according to the report we have gathered. So, with that kind of, without accreditations and medical knowledge, it's only talent and passion It is so interestingly that such kind of conventional medical skill, even performing surgeries on animals such as brain surgery on hippopotamus and surgery on hyenas, may not be applicable to human beings. So beyond reasonable doubt, Raila Odinga medication, doctors with only talent and passion, which is not qualified. Raila Odinga doctor, like Dr. Okaj's Kenyan Salah, was not able to assist him really without medication errors. So that's why it's a crucial question why Okaja talent we actually decided to provide him with medical assistance, which is of course with a lot of risk in that case, with a lot of medication errors, and that complication, complicity might have led to Raila Odinga death. I'm sorry to say this with all due respect. So in that kind of situation, we can say in a high-risk situation, complex medical cases, consulting without qualified doctors, professionals, which are trained expertise, which are not recommended by the government, cannot do a kind of or ensure the best possible outcome result of safety and protection of their patients. So anyway, that's why now we can say it was unlikely and unsafe for someone without formal medical training to perform surgeries on animals, to let out, kind of complex procedures like brain and heart surgeries to human beings. It can lead to death in that case, or any other kind of advice. They cannot be able to do it properly. So I can say without, any qualification and medical practices, we may be unconventional. We can say, in a conclusive evidence that it can lead to, Raila Odinga passing away. Otherwise, may God bless human being living in Kenya and beyond. I'm Bishop of Kenya, Michael Loltome speaking in our national government. This event is around 4:56 p.m. on October 17, 2025. Otherwise, may God bless human being living in Kenya, and let's pray for Kenya and maintain peace and order and respect the country, kind of rule. Otherwise, may God bless you, human being living in Kenya and beyond. Amen.